3、2、1、エクスプロージョン
What has happened to you? Please tell me. I have depression, doctor.
Hello everyone, my name is Beck, but you can call me Dr. Beck. It's a pleasure to meet you all. I have done doctoring in positivity and help bring smiles on the people's faces by telling them a cure. I am here to talk about a very dangerous human disease, that is depression. What is depression, you ask? Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feelings of sadness and loss of interest in activities once enjoyed. It can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, weight loss or gain unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activities, example hand wringing or pacing, or slow movement and speech actions observable by others, feeling worthless or guilt, difficulty thinking, concentrating or making decisions, thoughts of death or suicide. Symptoms must last at least 2 weeks for a diagnosis of depression. If you are depressed, please go to your loved ones or your siblings or anyone, or go to psychiatrists. Talk to them. When you talk to them about what you feel, that feeling will get reduced and you will never get depressed. The depression also will get reduced. The loved ones like our parents will guide us and bring positivity and give us strength to move forward. Symptoms must last at least 2 weeks for a diagnosis of depression. Also, medical conditions, example, thyroid problems, a brain tumor or vitamin deficiency can mimic symptoms of depression, so it is important to rule out general medical causes. Depression affects an estimated 1 in 15 adults, 6.7% in any given year, and 1 in 6 people, 16.6% will experience depression at some time in their life. Depression can strike at any time, but on average first appears during the late teens to mid-20s. Women are more likely than men to experience depression. Some studies show that 1/3 of the women will experience a major depressive episode in their lifetime. The death of a loved one, loss of a job, or the ending of a relationship are difficult experience for a person to endure. It is normal for feelings of sadness or grief to develop in response to such situation. Thus, experiencing loss often might describe themselves as being depressed. But being sad is not the same as having depression. The grieving process is natural and unique to each individual and share some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. They are also different in important ways. In grief, painful feelings come in waves, often intermixed with positive memories of the disease. In major depression, mood or interest are decreased for most of 2 weeks. In grief, self-esteem is usually maintained. In major depression, feelings of worthlessness and self-loathing are common. For some people, the death of a loved one can bring on major depression. Losing a job or being a victim of physical assault or a major disaster can lead to depression for some people. When grief and depression coexist, the grief is more severe and lasts longer than grief without depression. Despite some overlap between grief and depression, they are different. Distinguishing between them can help people get the help, support, or treatment they need. Some of the risk factors for depression are biochemistry. Differences in certain chemicals in the brain may contribute to the symptoms of depression. Genetics. Depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having the illness sometime in life. Personality. Person with low self-esteem, who are easily overwhelmed by stress or who are generally pessimistic, appear to be more likely to experience depression. Environmental factors. Continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression. Depression is among the most treatable of mental disorders. Between 80% and 90% of the people with depression eventually respond well to treatment. Almost all patients gain some relief from their symptoms. Before a diagnosis or treatment, a health professional should conduct a thorough diagnostic evaluation, including an interview and possibly a physical examination. In some cases, a blood test might be done to make sure that depression is not due to a medical condition like thyroid problem. The evaluation is to identify specific symptoms, medical and family history, cultural factors and environmental factors to arrive at a diagnosis and plan a course of action. Brain chemistry may contribute to an individual depression and may factor into their treatment. For this reason, antidepressants might be prescribed to help modify one's brain chemistry. These medications are not sedative, uppers, or tranquilizers. They are not habit forming. Generally, antidepressant medication have no stimulating effect on people not experiencing depression. Antidepressant may produce some improvement within the first week or two of use. Full benefit may not be seen for 2 to 3 months. If a patient feels little or no improvement after several weeks, his or her psychiatrist can alter the dose of the medication or add or substitute another antidepressant. In some situations, other psychotropic medications may be helpful. It is important to let your doctor know if a medication does not work or if you experience side effect. Psychiatrists usually recommend that patients continue to take medication for 6 or more months after symptoms have improved. Longer-term maintenance treatment may be suggested to decrease the risk of the future episode for certain people at high risk. Psychotherapy. Psychotherapy or talk therapy is sometimes used alone for treatment of mild depression or moderate to severe depression. Psychotherapy is often used along with antidepressant medication. Cognitive behavioral therapy (CBT) has been found to be effective in treating depression. CBT is a full form of therapy focused on the present and problem solving. CBT helps a person to recognize distorted thinking and then change behaviors and thinking. Psychotherapy may involve only the individual, but it can include others. For example, family or couple therapy can help address issues within these close relationships. Group therapy involves people with similar illness. Depending on the severity of the depression, treatment can take a few weeks or much longer. In many cases, significant improvement can be made in 10 to 15 sessions. ECT is a medical treatment most commonly used for patients with severe major depression or bipolar disorder who have not responded to other treatment. ECT means electroconvulsive therapy. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. A patient typically receives ECT 2 to 3 times a week for a total of 6 to 12 treatments. ECT has been used since the 1940s and many years of research have led to major improvements. It is usually managed by a team of anesthesiologists and a nurse or a physician assistant. There are a number of things people can do to help reduce the symptoms of depression. For many people, regular exercise helps create positive feelings and improves good mood. Getting enough quality sleep on a regular basis, eating a healthy diet and avoiding alcohol can also help reduce the symptoms of depression. Depression is a real illness and help is available. With proper diagnosis and treatment, the vast majority of the people with depression will overcome it. If you are experiencing symptoms of depression, a first step is to see your family physician or psychiatrist. Talk about your concerns and request a thorough evaluation. This is the start of addressing mental health needs.
तब तो आपको पता चला होगा कि डिप्रेशन क्या होता है। आपका एक छोटा सा जोक दूसरों के लिए ऑफेंड करना या हानि पहुंचा सकता है। तो अगले एपिसोड में मिलते हैं, तब तक अपना और अपने परिवार का ख्याल रखें, सुरक्षित रहें और सतर्क रखें। सबको सीखम सबको। जय हिंद।